It's 8:45. Once again, we're talking about COVID in Connecticut with Dr. Hussain from Trinity Health of New England, as we do every Tuesday. Good to see you again, Doctor.
Morning.
Glad to have you here. A lot to talk about. First thing, let's talk about vaccine hesitancy. There was a new poll out by the Kaiser Family Foundation that showed a lot of parents of at least young children do not plan on getting them vaccinated, and this appears to be following a larger trend.
It is, Tim, and it's unfortunate, but it's important we address the hesitancy and the causes behind it. We know there's been vaccine hesitancy, which has, grown during the course of the last 2 years in this pandemic. A couple points I do want to make to viewers, to parents who are on the fence. First point is we've now vaccinated. We've given out billions of doses worldwide since this vaccination campaign started a year and a half ago. What we do know based on that data is that these vaccines are safe, they're effective, and they prevent severe outcomes. Second point I want to make to parents is that we know this virus, based on how it's behaved over the last 2 years, it's just a matter of time before we get a new variant. Whether that new variant is more transmissible and able to cause more severe disease as we head into winter months is important to keep in mind. And third point is, yes, it's true children tend to get less severe disease, but we've seen some severe outcomes in children, and as well as deaths. So it's important that we, when we have safe and effective vaccines in our midst, that we protect our children. And there's no predictive tool to say, okay, this child's going to come down with severe COVID-19 as opposed to someone else.
Yeah, those are two good points. I know I'm going to ask you a question that's not really answerable, but we were starting to see vaccine hesitancy in other areas before the world even knew about COVID. And now that's only accelerating. People starting to be more hesitant to get the standard childhood immunization schedule filled completely. What kind of a problem is that, and how do you even begin to approach that? Because it's not necessarily a fact problem, it's a messaging problem.
It is a messaging problem, but I always come down to let's look at the science. We've been able to make such big strides in medicine, especially in the vaccine arena, in terms of combating diseases that took such a big toll, such as smallpox, polio, for instance. So we know these vaccines are safe, they're effective. And one other thing I want to mention to parents is that the CDC has a very robust monitoring system in place in this country, Tim. So we're able to detect any kind of small degree of severe, allergic reactions or outcomes as a result of vaccines. It's very closely tracked, and that's what happened with the Johnson & Johnson vaccine, for instance. It's a needle in a haystack.
Right.
And so,
but we got a big haystack. I don't think there's ever been billions of doses of any other vaccine that have been monitored to this degree.
That's right.
That's something to think about. Real quickly, I want to talk about the people like myself and like a lot of you who have never knowingly had COVID. I'm curious how many of us actually have.
Great question. So we know based on this virus that up to 40% of people can have asymptomatic disease. So I wouldn't be surprised if the numbers are high. But from a clinical angle, my biggest goal is to prevent severe outcomes and death.
And that's the idea. That's where the vaccines are coming in handier, even as the new subvariants are finding ways to sort of circumvent our first-line defenses. The last-line ones to stop you from getting seriously sick. Those are still holding up pretty well. All right, going to see if anything comes out of this big meeting with the White House today regarding next-generation vaccines. We'll talk about that maybe this time next week after the meeting today. Good to see you again, Doctor.
Thank you.
Glad to have Dr. Hussain from Trinity Health New England, as he is always here every Tuesday morning to talk about this. Even though we're kind of sick of talking about it, the virus doesn't care. It's spreading maybe as much now as it has any time, Matt Scott, in the past several months across Connecticut and across the country. It's out there.
Yeah, and it's not going away. I mean,